Assalamu alaikum student. Today our topic of discussion is astigmatism. What is the definition of astigmatism? Astigmatism is basically a form of refractive error in which there is not a single focal point but there are two or more focal points. Maybe rays focus in front of a retina, maybe focus behind the retina, maybe some rays focus at the retina, some in front of the retina, some behind the retina. All the positions are possible. Basically, this is the definition of astigmatism. Now we are going to explain the types of astigmatism. Two basic types are regular astigmatism, irregular astigmatism. Now we are going to explain the types of regular astigmatism because regular astigmatism has further three types. First of all, with the rule astigmatism, if the curvature in the vertical meridian is more, this is with the rule astigmatism. We can say if this comes to if this curves 30 degree towards right side or 30 degree towards left side from its normal position from 90 degree, then this is with the rule astigmatism. You can say it's here it came from 90 degree to 60, here it came from 90 degree to 120 degree. You can simply say if there is problem in vertical meridian, this is with the rule astigmatism. Now against the rule astigmatism, if there is problem in the horizontal meridian, this is called against the rule astigmatism. We can say if horizontal meridian is more curved, this is against the rule astigmatism. It will be curved up or down from its normal position till to 30 degree. Here you can say from 180 to 150. Here you can say from 180 to 120. Sorry, this is not 120, this is you can say also 150. It move curve till to 30 degree. We can say if problem in horizontal meridian, this is against the rule astigmatism. Third one is oblique astigmatism. If the axis is curved, axis lies 15 degree from central point of 90 or 180. The central point of 90 and 180, what is the central point? Central point from 0 to 90 is 45 degree. Now it is at 30 here, here is 60. In this direction 15 degree from 45, in this direction 15 degree from 45. Now from 180 to 90, central point is 135. Now here is at 150 means 15 degree, here is 120 means 15 degree. This is oblique astigmatism. Now we are going to irregular astigmatism. Here the rays, there will be an irregular image. Here rays will not focus at 2 points, there will be multiple focal points, multiple focal points. As a result, there will be an irregular image, there will be no proper image. Therefore this is called as irregular astigmatism. Now what are the causes of astigmatism? If there is a problem in curvature of cornea, curvature of lens, this is called as curvatural astigmatism. If lens is not at its normal position of lens is changed, this is called as positional astigmatism. With the age, lens start hardening, the index of lens increases, lens fibrous elasticity decreases, index increases, therefore it's called as index astigmatism. Sorry, I have skipped the other types of astigmatism. For example, you can say types of with the rule astigmatism. Simple astigmatism. If some light rays focus at the retina, other focus in front of retina, this is called as simple myopic. If some rays focus at retina but other rays focus behind the retina, this is called simple hypermetropic. If some rays focus at retina, other focus in front of the retina, this is simple myopic. If some rays are all the rays are focusing behind the retina, this is compound hypermetropic. If all the rays focusing in front of the retina, this is compound myopic. If some are focusing behind the retina, some are in front of the retina, this is mixed hypermetropic. Now I have explained the cause. Now features. What are the features of astigmatism? First one, because it's a type of refractive error, there will be blurred vision. Now asthenopic symptom. Patient uses so much accommodation to obtain a clear vision. He put the strain at the eyes. Then as a result of strain, there will be pain in the eyes. This is called as asthenopic symptom. And there also will be headache. Pinhole effect. If a patient's vision is weak, then he closes his eyes and try to see the objects clearly. This is called as pinhole effect. Because of astigmatism, fundus examination shows oval shaped disc. This is also a feature of astigmatism. Now we are going to diagnose this. With the help of 3 techniques we can diagnose astigmatism. First one is retinoscope, so much simple. Second one is keratometer. Third one is corneal topography. With these 3 techniques we can easily diagnose astigmatism. Final step is treatment. How we can treat astigmatism? First step, with the help of spectacles. Spectacles will be, there are 2 types of spectacles. Simple cylindrical lenses. Simple cylindrical spectacles can treat astigmatism. Otherwise spherocylindrical spectacles can also treat astigmatism. Contact lens, these with the help of contact lens we can also treat astigmatism. PRK, I have already explained PRK, photorefractive keratectomy. This can treat up to 3 diopters. LASIK, laser epithelium keratolysis. This can also treat up to 3 diopter. LASIK, laser in situ keratolysis. This can treat up to 5 diopters. Now AK, astigmatic keratectomy. Here we cut down the cornea at different positions. This is called as astigmatic keratectomy. These are the treatments of astigmatism. I have explained the astigmatism in detail. If you have any question, you can ask from me. Thank you so much.